Hello, my name is Dr. Rahmatullah Khan. I'm a clinical psychologist as well as a professor in clinical psychology at the Sultan Idris Education University. And I'm a visiting consultant at the KPJ Damansara Specialist Center. Stress is actually part of everyday life. People may ask you, what's the need of stress? Why we are so stressful? But actually, come to think of it, actually stress is actually necessary in our life. We need to have some stress, but we need to be able to manage our stress in order for us to cope with our life situation. There is a good actually definition about stress by Hans Selye. He says that the non-specific response of the body to any demand. Stress is a demand made upon the adaptive capacities of the mind and body. Because what happens is that when you have stress actually affects your mind as well as your body. So it depends on you. There are three aspects of stress. First is that how you experience stress depends on your personal view of the stressor. Because you can take something as a negative or something as a positive. Another thing is that your reaction to events in life, or rather the actual events, is what actually will determine whether the outcome will be positive or negative. Let's say you have something in your life that is stressful. How you look at it, if you look at it as a positive, it becomes a challenge. But if you look at it as a negative, then it becomes a problem for you. Stress is actually it has a demand on your body, because if your body has a capacity to handle stress, that means if your body is healthy, then you can handle stress. But if your body is weak, then you will have a problem handling stress. So that's why in life we can see some people cope very well with stress, whereas some people can't. As time goes on, the body becomes there is a wear and tear on the body. In stress, you have what we call eustress, which is a positive stress, and the distress, which is a negative stress. A positive stress is like, for example, there's a promotion. You are promoted. So as a result of the promotion, it becomes stressful for you because you have new things to do, new work, new jobs, new responsibilities and all that. And then you have the negative stress. Negative stress, for example, you lost in something, or you overwork, or you can't cope with your, So this is actually a negative part of the stress. It is also stressful. So both the positive and the negative actually affects you. The causes of stress are actually can be external as well as internal. External can be, for example, you are moving house, so that's external, or there is a death in the family, or there is divorce. So these are actually what we call external stress. That means it is within, outside, and it can also be caused from your pressures of everyday life. For example, financial difficulties, or for example your deadlines or arguments, or lack of sleep. These are also what we call external stressors. And as a result of this, you will notice that there are certain things that will happen to you, because whenever you are facing with stress, your heart rate increases, your blood pressure increases, you have sweating, So these are actually some of the fight and flight response, the responses of the body towards stress. There are 5 areas of negative stress: physical, emotional, intellectual, spiritual, and social. Let's look at some of the physical effects of stress. One is actually muscle tension, headaches, teeth grinding, fatigue, insomnia, backaches. So these are some of the physical effects of stress. And then you have intellectual effects of stress. For example, forgetful. People can have a poor concentration. Sometimes when you see someone who is so much stressful, they cannot concentrate on what you are talking. So this is poor concentration or low productivity, negative attitude, confusion. These are some of what we call intellectual effects of stress. And then you have emotional effects. Emotional effects are, for example, anxiety, frustration, nervousness, worrying, tension, mood swings, crying spells, irritability, anger. These are all the emotional aspects of stress. And then you have spiritual. Spiritual can be things like lack of meaning. The person doesn't have a meaning in life, or lack of purpose, or the person is lonely or is depressed, or low self-esteem, feeling abandoned. These are all the spiritual. And finally you have the social. Social aspects are what we call that he feels isolated, or lashing out, or nagging, or fewer friends, or using people. So these are actually some of the social aspects of stress. In long-term effects, what happens is that a person actually, most people can bounce back. If they are facing a lot of stress for a long time, they can bounce back. But there are some people who can't. They totally change. The personality become changed. They totally become a different person. They may become depressed and cannot get out of the depression, or they feel helpless, or they feel hopeless. They become impulsive. They have exaggerated fears, or they can also develop anxiety attacks or panics. So these are what we call, and including that are also the physical problems. Physical problem, people can develop cardiovascular disease, high blood pressure, ulcers, or headaches. As a result of long-term effects of stress. So these are some of the long-term effects. So that's why we don't recommend people to be exposed to long-term stress and not doing anything about it. Now that you are familiar with the symptoms of stress, what do we do? How do we manage ourselves? There are certain things that we normally teach people. First thing, we teach them how to do deep breathing, because deep breathing is important in relaxation. Because when you relax, then what happens is that your body cannot exist in two situations at one time. For example, you cannot be stressful as well as relaxed. So when we teach you how to relax, then automatically the stress symptoms goes off. And relaxation can be done in various ways. You have imagery, you have progressive muscle relaxation, and all those. And exercise can also be taught. In addition to that, we also teach people how to cope with daily activities. Be realistic in life. Don't take too much. Saying no to certain demands. And to see how the person can handle. And then also, for example, positive self-talk, because some people can have negative thinking. So we have to analyze what are their thinking, and then we teach them various to change their thinking from a negative one to become a positive. And then also teaching them how to take charge of their life. See, sometimes they are all controlled by other people, whereas they have actually their own life. So these are certain things that people need to learn in order to cope with stress in their life. When you are feeling with stress, when do you actually get help? Actually, this one you should not wait until the effects of stress become long-term. That means when you have early signs of stress, you have headaches, you cannot figure out why you are having headaches, or you have problem with sleep, or you have problem with concentration. This is the time actually to seek for help, because you can attend programs of stress management, or seek help from psychologists, how to cope with your stress in your life. Don't wait for too long, because if you wait for too long, sometimes it will be taking a longer time for you to recover, to bounce back from the stress. So don't wait for too long. Okay, going through life you will face stress, but actually stress can be good or can be bad, depending on how you look at it. So if you have to you improve yourself, you get help, you change your lifestyle, you become a better person. So I wish you all the best.